When you're talking with a patient, you give them the fee and all of a sudden they go, oh my goodness, that's so much money. Who thought it was that much? Or, gee, that's expensive. I mean, that sometimes happens, and especially if you're talking with patients about significant treatment, a couple of implants, a few crowns, some veneers on the front teeth, and suddenly it adds up and you're talking real money. We're talking tens of thousands of dollars. So it is very significant money. What do you do when the patient goes, oh my goodness, you know, I never knew it was that much? Well, the first thing is remain calm. Just don't let it get to you. Just relax, just sort of they're expressing their opinion and they are right. I mean, dentistry is a significant expense in people's lives, especially when you're doing big cases. So just first thing is remain calm. The second thing is don't get defensive. Don't start justifying and saying, oh yes, but I use a fantastic lab and I use these wonderful materials and this and that. I've found that sort of thing cuts no ice at all with patients. I mean, they assume all dentists use great labs and great materials. The next thing I'd suggest is don't become a smartass. Like I've heard people say to dentists, what they should say to the patients is, oh, you know, when they say, gee, that's expensive, and you should say, oh, compared to what? Or is cheap important to you? You don't want to come off as a smartass. So I think the easiest way, the best way, and the way that's got the greatest success in my view, is if a patient says to me, gee, that's expensive, or gee, that's a lot of money, what you've got to do is just very humbly let go of your ego, just relax, look them in the eye and go, yeah, it is a lot of money. And of course, once you totally admit it, once you roll over and just sort of say, well, yep, you're right, it is a lot of money, and just do it without defensiveness, without sort of aggression, just you understand what they're saying, there's really nowhere for them to go with it. There's no further argument needed. And my usual experience once I do that is they go, okay, let's do it. And there you are. So there's a very simple, easy approach to what to do and what to say when a patient says, gee, that's a lot of money. I'm Dr. Mark Hassard, the Relaxed Dentist.